Thank the gentleman. Let me call upon the gentleman from New York, Mr. Suozzi, to inquire.
Thank you, Mr. Chairman. This is such a complicated topic. We're obviously not going to solve it all today, but I want to thank all of you for the time that you've put in here today and the time you took to get here and to work on this. People are so sick of us sniping with each other, you know, the Democrats and Republicans, and they're just sick of it. It's not about the Democrats are winning, the Republicans, we're all losing. People are sick of politicians. They're sick of us not just sitting down and working this stuff out. And Ms. Wood, what you talked about today, you know, you represent so many millions of people in America that you spoke for today, because there's so many people suffering with so much anxiety and so much fear about what am I going to do to take care of my family? What am I going to do to take care of myself? And that's what this is about. This is not a small, petty, cynical topic that politics is made out to be in today's world. This is life and death for people. This is serious business, and we really need to elevate the conversation. And I thank you so much for helping us to recognize that you're not alone, and there's so many people that really you represent today. So we're so grateful to you and Charlie for being here today. Dr. Newman, I just want to clarify some facts that the numbers always jump around. I want to see you, I think, would be a good source to help with this. Right now, there are how many people in America that you would say get their insurance from their employer? Put your...
About 160.
Okay, I always put 175 million, so we're close.
Million, sorry.
165 million, 160 to 175 million. And there's about 100 million people who get their insurance from Medicaid and Medicare, would you say?
About 120 million.
Oh, okay. And there's about 30 million people still uninsured in the country?
Correct.
And there's about 15 million people who get their insurance from the private marketplace, the individual marketplace.
Non-group markets, many of whom are in the marketplace.
And that's where we hear all these horror stories about skyrocketing premiums, people pulling out of the market. That subset of 15 million people is really where we hear all these awful stories about what's going on. And I'm going to ask you in a little bit, Ms. McEwen, about some of the short-term fixes that we need to address what's going on in the individual marketplace. So 330 million Americans, all different status as to what's going on with their insurance. So right now, Kaiser, I think, has done polling on how many people like their insurance the way it is now. Is it number as high as 70% of the people in America like their insurance?
I haven't looked at the number recently, but people tend to like their insurance. The issue comes about what happens when people are sick.
Right.
That's really the issue. Most people are satisfied with their coverage. People adore Medicare. You know, you can't take people.
Well, one of the reasons that there's a lot of demagoguing on the different solutions is that people try and make people who like their insurance now have fear that you're going to take away what they like already. So that's one of the big challenges we face here, is when people demagogue instead of trying to work in good faith to actually try and figure out this issue, because they create fear in people's lives. So I don't think we're going to get to the long-term solution today that will address all the things that Dr. Bierwick said to try and improve everyone's care, improve everyone's health, reduce their costs, and coverage for all. I think anybody of good faith, that's what everybody's objectives are. Dr. Berwick, what you laid out, I think that's everyone's objective. But Ms. McEwen, what are those short-term improvements you talked about so we can mend, not end, the ACA? What do we need to do to, especially in that individual marketplace?
I think reinsurance, which was a program that was in it about 3 years ago, is critically important. Our state looked into it a year ago, and we could not afford it. Some states like Maryland and Minnesota have been able to go forward, but those states have the funds. Most states can't afford to do that. This is something where federal help is absolutely...
So reinsurance is a big short-term fix. How about subsidies for people?
Subsidies, people cannot... Affordability is the most critical thing, and there's a cliff right now. When people hit 400% of FPL, they're cut off. They can't access subsidies anymore, and there are a lot of middle-class families that are being hurt very badly, and they're paying far higher percentage of their income than they should be for their health care.
So short-term reinsurance subsidies for in the individual marketplace can make a big difference in a lot of people's lives that are freaking out right now. Now, how about something more dramatic? I want to know from you, Dr. Berwick, how do you feel about the public option? I know you're a Medicare for All pusher, but how do you feel about the public option?
Better than we have now. I wish we had one. I think we'd be learning a lot if we had a public option about what it does to risk pools and so on. I'm a little worried about the public option for a kind of technical reason. Insurance companies want to provide insurance to people that don't need it. That's how they make money. And so anything that can be done to game risk so that...
public option would be used by all the people who really need the insurance the most.
Yeah, and if I were insurance companies would then try to find ways to have people who really need care go to the public option, which would enrich. It'd be a good business case for them, and that's not good for the country.
Ms. Brooks, do you like the public option?
I think there are a lot of the benefits that we're talking about that would be achieved through a public option. As you know, the House thought about one in the ACA. I think it could go a long way to lowering premiums and making coverage more affordable today. I also think having a stable option across the country is a very important measure.
Thank you so much. Ms. Turner, I wanted to ask you about the public
Thank the
option, but I've
gentleman.
run out of time. I'm
Gentleman's
sorry.
time has expired, but we thank him for his commentary.